And it's Friday, March 20th, 2020, a busy one. I'm Justin Gould, and here's what's happening. We have the latest on the effort to stop the spread of the novel coronavirus here in Chautauqua County. The county's executive joins us live with what we need to know. Plus, how local businesses are now lending a hand to those in need.
Well, the radar shows you it's been wet out there this morning. That will continue this afternoon. Some storms could contain gusty winds. We'll time it all out in just a few minutes as the news at noon starts right now.
Live and on demand, this is WNY News Now.
Thanks for joining us for WNY News Now as we continue to put facts over fear. I'm Justin Gould. So far, no one has tested positive for the novel coronavirus here in Chautauqua County, although the number of those under a precautionary quarantine is up. During a Thursday afternoon press conference, Chautauqua County health officials announced that there are now 35 people quarantined. That number up 15 since the day before. Christine Schuyler, she's Chautauqua County's Commissioner of Health, says that it's hard to get testing kits right now in the county.
It actually is more of a challenge right now in Chautauqua County, and that is because resources are being distributed by priority from the state and from the feds on the trickle down to those counties who have had more confirmed cases and where they have a larger evidence of community spread. Since we in this county have had no confirmed cases yet, we are very high on that priority list.
Now, officials say the best way to prevent the illness right now is by taking preventative measures like washing hands and staying home if you're sick.
We have to be in our best fighting condition, and that means each one of us has the personal responsibility to keep ourselves as healthy as we can, because the healthier you are, the greater the chances you're going to be able to fight off a virus. That means getting enough sleep, eating right, exercising, doing the stress reduction techniques that you can find out there anywhere. We're very fortunate at this time, I guess, that we do have all of the technology that sometimes we complain about, because we are able to check on our friends and our relatives and our neighbors anywhere.
Coming up, Chautauqua County Executive P.J. Wendell joins us live with the latest on the virus fight here, that in an interview just 7 minutes away. New York State is now directing all barber shops, hair salons, tattoo or piercing parlors, and related personal care services to close amid this virus outbreak. And just this morning, they announced 100% of non-essential business workforces are now being ordered to work from home. Governor Andrew Cuomo says that the services cannot be provided while maintaining social distancing. The directive states that the businesses should close effective as of Saturday at 8 o'clock. Now, on Thursday, the state announced indoor portions of retail shopping malls as well as amusement parks and bowling alleys were ordered to close. Earlier in the week, the governor announced limits on crowd capacity for social and recreational gatherings of 50 people. The governor also announced that restaurants and bars would close for on-premise service and move to takeout and delivery services only, and that movie theaters, gyms, and casinos should close as well. Well, President Trump says that he's pushed the Food and Drug Administration to eliminate barriers to getting treatments for coronavirus to patients. Nick Watt has more on the promise of therapies as well as other challenges officials are facing nationally in the crisis.
It's here, it's spreading. The FDA now fast-tracking antiviral treatments, one currently used against malaria.
It's going to be very exciting. I think it could be a game changer, and maybe not.
A vaccine still some time away.
It has changed everything, and it will for the foreseeable future.
Carnival Cruises apparently now offering up its fleet.
If we should need ships with lots of rooms, They'll be docked at New York and Los Angeles and San Francisco, different places.
A field hospital on U.S. soil, Washington state. Around 10 million Californians told to shelter in place. A $1 trillion national stimulus on the table.
If everybody stays home for 6 months, then, it's hard to, it's going to be like the Great Depression.
Clusters cropping up, at least 46 positives now at this one Illinois care home. 3 dead, 4 others infected in just one extended New Jersey family.
Hospitals across the country are rapidly running out of masks, gowns, protective eyewear that they desperately need. We are being asked to reuse and recycle single-use respirators and surgical masks when we go see patients.
The CDC now advising use homemade masks, e.g. bandana, scarf, for care of patients with COVID-19 as a last resort. And in areas with community spread, consider allowing asymptomatic exposed providers to work while wearing a face mask. Here is one face of this growing pandemic.
You choke, you throw up, the pain, the headache.
And here's another.
I feel like we shouldn't change our lifestyles necessarily just because of Corona, especially because it hasn't been affecting younger people. I think that's why we don't take it seriously.
Florida's beaches are still open.
You've got to figure out how to get these people off the beach. Unless you can figure out how to completely be isolated from anybody else. I mean, individuals got to take responsibility.
Because even if you don't suffer much, you can give this to others. Although up to 20% of coronavirus hospitalizations in the US are between 20 and 44, according to a new federal study.
People need to pay attention, no matter your age.
Some U.S. congressmen have now confirmed they have the virus. Georgia's entire legislature told to self-quarantine for 2 weeks after a state senator tested positive. In France now, to leave home, you need a certificate stating where you're going and why. They've cited thousands.
I am not going to imprison anyone in the state of New York. I am not going to do martial law in the state of New York.
But they are considering converting New York City's hotels into hospitals. The European Union now urging Netflix and others to stop streaming HD so we don't all actually break the internet while we hunker down.
All right, Nick, thank you. The novel coronavirus can remain infectious on plastic and steel surfaces for up to 3 days. That important information comes from a study that was published in the New England Journal of Medicine. Now, that study is supported by the National Institute of Health. Now, how long the virus can survive depends on the type of surfaces that it contaminates. For instance, COVID-19 can be detected on copper for up to 2 to 4 hours and on cardboard for up to 24 hours. The coronavirus can linger in the air, suspended in many particles for up to 3 hours. The research explains how infectious the coronavirus is. It actually is similar to SARS in a way, according to researchers. The study also shows why coronavirus may be more infectious in a medical facility because many treatments like nebulizers, suction devices, and CPAP machines can generate aerosol transmissions. Now, based on this research, frequent deep cleaning of all surfaces could make a difference in prevention. Well, a Jamestown area business is working to help others by offering a free service amid the novel coronavirus outbreak. JRSC Express at 1611 Foote Avenue Extension is now offering free package receiving for businesses who are not able to receive mail at their normal location. Jessica Townsend, manager of JRSC Express, says the process to set up the service is simple.
You can address your packages with your business name to 1611 Foote Avenue, Jamestown, New York. Then send us an email to express@jrscexpress.com just to let us know that it's coming so we can keep a lookout for it. And then once we've received your package, you're able to pick it up during our business hours.
In addition to the free receiving service, JRSC Digital, JRSC Express's sister brand, is selling CDC signs to help businesses follow guidelines.
Just in an effort to make people aware of the social distancing that's going on and that we're all trying to take part of, we're offering these signs. They can be printed on a rigid plastic material so it stands up on its own, or we can also supply you with a removable wall decal so you can put it up, take it back down when necessary with no damage to your walls or windows, and those are at a very reasonable rate of $2.50.
JRSC Express also offers portable storage containers for those who may need a quick and safe place to store items. For more, visit jrscexpress.com or call them at 716-484-6948. Now, the company is also auctioning off a 45 mega roll pack of toilet paper. Anyone who visits their facility is eligible to enter that contest. Well, hopefully everyone is having a good Friday, and we thank you for joining us here on WNY News Now. We have a lot more to come in this broadcast, so I'll keep this part quick, but let's check in with the comments and see how everyone's doing. Gotta say hello to Mike, hello to Justin, hello to Michelle, Connie, Samantha, Heather, Lori, Kathleen, Amanda. Thank you all for joining us. Michelle, she's asking, what are the essential business list in New York? Well, according to the governor's office, now this is according to a release that was sent out yesterday, so we're not sure if they would modify this, but as of the latest information we have from the governor's office, they say exemptions on the workforce reduction includes shopping, media, warehousing, grocery, and food production, as well as pharmacy, healthcare providers, utilities, banks, and related financial institutions. This is also important to note. They say other industries that are critical to the supply chain are not impacted by those reductions. And the governor's office says for this new mandate that was released not even a half an hour ago, they will be sending out new information, which we will bring to you here as soon as we get it, and on WNYNewsNow.com and on our mobile app. Well, let's switch gears and get a check of our First Defense weather forecast now. And Chief Forecaster Dakota Hunter is here. And Dakota, you, sir, are also fairly busy.
Yes, indeed. And, you know, just one comment about the toilet paper. Who would know that at this point in our lives we'd get excited over an auction over a mega roll of toilet paper? Anyway, here's a live look at radar. You can see here that the rain we've had this morning has started to hightail out to the east, but there's another line of showers and storms developing out here to our west. That is the cold front that's going to be moving on through. So temperatures will slide back this afternoon as that cold front moves through. High wind watch was upgraded to a high wind warning, and it's been extended to much of the southern tier. Does not include Allegheny County. You're under a wind advisory, but everybody else in the southern tier is under a high wind warning. That goes until 5 o'clock this afternoon. So wind gusts could be near 50, 60 miles per hour at times, especially near the shoreline. We'll show that to you here on the modeling here. This is where the winds are going. So by about 2 p.m. this afternoon, again, look at Buffalo, close to 60 miles an hour, Dunkirk at 57, right near the shoreline because of a west-southwest wind. That's going to obviously funnel all of that wind across the lake. So right at the immediate Lake Erie shoreline, you'll stay a little bit windier. But hey, as we head into the evening hours, the winds start to subside, so it won't be as windy as we go into tonight like it was the past couple of nights. So through the afternoon today, showers and storms redevelop. A few could be stronger with gusty winds. There is a marginal risk for essentially any severe activity. We'll talk about that later on. The temp falls. This is where we're going to end the day. 39 at the immediate Lake Erie shoreline to 46 inland after temperatures well up into the 60s. But it turns drier over the weekend, but chillier. We'll talk about it in full detail in just a few minutes. Jay?
All right, Dakota, thank you very much. Coming up next, Chautauqua County Executive PJ Wendell joins us live with the effort to fight the novel coronavirus here in Chautauqua County as we reflect on all that has changed this past week. Stay with us.
With coverage that matters, this is WNY News Now.
EagleZip.com is your local one-stop shop for all of your home and business computer needs. Located on Fluvan Avenue Extension, just outside of Jamestown, EagleZip.com sells and services all brands of desktops and laptops, as well as servers and network equipment for your business. All new computer sales include transferring your data from your old computer plus a 2-year warranty. Call EagleZip.com today.
Stop by EagleZip.com today and let us make computers easy for you.
This is Christine Schuyler, Chautauqua County Public Health Director, with a very important message. We need you to make every effort to protect yourselves and our healthcare workers. If you absolutely don't need to go out, don't. If you have a mild cold or flu-like symptoms, with or without a fever, stay home. If your symptoms are severe, call your healthcare provider. Do not go to the emergency room or urgent care. Do not call 911 or go to the ER unless you are experiencing a life-threatening emergency. The best ways you can help prevent the spread of COVID-19 are to wash your hands often with soap and water, cover your cough, avoid close contact with others. Please stay home.
You're watching WNY News Now, your source for breaking news.
Welcome back to WNY News Now. Joining us in studio is Chautauqua County Executive PJ Wendell to talk more about the novel coronavirus pandemic here in our area. PJ, we thank you so much for being here with us.
Thanks for having me.
So, first off, I want to ask you, because this week has been something, that's for sure. What has it been like for your administration since first announcing some big steps on Sunday here?
Well, you know, we've been meeting daily, so it actually started Saturday with the first initial meeting. Now I meet daily at 9 a.m. with my COVID-19 response team, and we discuss any information that comes over through the evening, and then decipher that and get it out. One of the things we're really tracking are the governor's executive orders, and as we've seen today, prior to the broadcast, the governor is issuing 100% reduction in workforce, and then the executive order comes later. Well, that's a lot of people are concerned right now. There's a lot of animosity, or not animosity, a lot of angst maybe for some people. Yeah. What do we do? And then the executive order comes out later. So for us, we're trying to help people understand that, because we don't know any more information than people who saw the press conference today. So as that comes out, we then make sure we have all of our I's dotted and T's crossed. I'm on 3 conference calls daily with latest news and information as far as the numbers go, statistics go, the executive orders get explained. Then we have a direct contact with the executive chamber, with just the county officials, and then we have another one later on tonight with our NYSAC county executives meeting. So again, we're getting in touch with a lot of information, and especially through NYSAC, Steve Aquarios, our executive director, is doing a great job, not only federal but state information as well. So I can't say enough about our contacts with Senator Borrello, Assemblyman Goodell. We've actually worked with Assemblyman Giglio as well, and Congressman Tom Reed. We've been great. It's a unity of this effort, and we're moving forward, and unity is going to win. Realistically, it's really what's going to prevail. Everybody working together.
It certainly does. I mean, all levels of government now just have to be on the same page. Going forward, do you think it's going to get a little easier?
Well, as we've said before, once that positive test comes back, it's going to be a challenge to get the information out and the correct information. We've taken a leadership role in county government to make sure that the proper and correct information gets out. Right now, in the absence of information, people tend to, look at other types of avenues and information. But right now, the most up-to-date information will come from the county executive's office, also County Department of Health. So when that happens, we like to think that because of all of our planning, that it will almost seem that it's easy for us. But we know that once this happens, then the media piece, the communication piece, the getting the information out is really going to ramp up. Yeah. And we really want to make sure that we're on point with that. We have contacts with our business leaders. We have contacts with our faith-based leaders, schools, daycare providers, our healthcare, our county physicians, Dr. Burke, Dr. Falk, and Dr. Walters, are another cohesive part of our group that are giving us the medical information and then feeding that back out to the medical community and healthcare providers. So our group is very strong. We're very cohesive. We all have the same message. We all have the same effort. And right now, communication and solid messaging is what we're looking to get out to the public.
And just to tell our viewers here, when we get a press release or information of notice from county government, we at WNY News Now don't change the context of that release. And especially now, we try very hard not to rewrite too much of it in order to try to get that word out to you. So for our viewers then, just correct me if I'm wrong, but right now we still have no cases of the virus here in Chautauqua County. What is the message that you want people to do going forward?
Well, I think the message is what we are doing is working. You know, the governor has given us, he's made executive orders that have helped keep social distancing. As you know, now he's limiting non-essential businesses. So the efforts the governor has taken have been applauded, and I too applaud the efforts that he's taken. The downside for us is a little, trying to get that information out with the executive orders. But they're coming, and we are getting guidance. It just doesn't come out, hand in hand with the press conference and the press release. But the efforts that we could tell everybody, and this is everybody, we need to maintain social distancing. You can be outside. I was out the other day. We said in the press conference, people are walking, people are playing tennis, people are enjoying the outside when the weather breaks. That's what we're looking for. Health is a lot more than just, breathing well. It's getting outside, getting that fresh air. If an opportunity arises, open windows, get that stale air in your house out, circulate some air. But realistically, just take those precautions. We really want to make sure, because young people especially, this goes out to you guys, you may not be susceptible, but you could be a carrier. So that's the problem is, you don't want to hang out with your friends and all of a sudden you go visit your grandma because you're pretty tight and you want to make sure she's okay. And all of a sudden you're a transmitter. And now grandmother, grandfather, even parents, depending on age, get this. And that's really our concern. Limit social gatherings, limit, hanging out with friends. And, if you're going to go for a walk in nature. Get out in the, all of our state parks are free now. Go to Midway, Long Point, get out and walk. Go to the state lands, walk the trails. Get out there and get that energy going, get that exercise, open up your lungs, really, get that air circulating. That's the best thing we can tell people. Social distancing, being cautious. Wash your hands, wash your hands, wash your hands. Yeah. Sing happy birthday and twice. Those things really are going to go a long way. And right now, I'm very confident that what we're doing so far has really helped us mitigate the spread of this disease, that we don't have cases right now.
Now, I know a lot of people are still reaching out to us, and I'd imagine maybe your office too, who say, I want to get tested. How do I do that? But right now, there's a limited number of testing. I know the public health director, Christine Schuyler, yesterday explained because as counties don't have that many cases, there's only so many supplies to go around. What do you say to people who want to get tested, but right now we just can't afford that?
Right now it's unfortunate, because everything is limited. You're exactly right. The testing swabs have been limited, the medium has been limited, the reactants. This is just part of the situation. When I get on these conference calls and, the other county executives are like, how are you doing this? I'm like, I think we're doing good because we're following the instructions, we're following our guidance, and we're staying, away from the positive test. But having said that, we know it's here. But because of that, the resources are being funneled to other areas that do have those greater impacts. Best thing to do is if you feel the symptoms coming on, reach out to your primary care physician. Do not flood our ERs. Do not flood our urgent cares. We really need to get the message out. The ER is for emergencies. If you have a life-threatening emergency, that's where you need to go. Otherwise, if you're feeling sick, you think you may have the symptoms, call your doctor. Telemedicine has been brought online on many of our doctor's offices, so call your doctor. Listen over the phone. In some cases, they can even look at you via, an iPhone or an Android, and the doctor can help diagnose there. Unfortunately, a lot of people say, well, I want to know if I have it or not. What Christine Schuyler said yesterday is whether you have it or not, the treatment isn't going to change. It's a virus. There are no remedies right now. They're looking at some studies, some things that come out with antiviral medication, but right now there is nothing. So whether you have it or not, the method is going to be the same. Quarantine yourself for 14 days, wash your hands, have plenty of fluids. Dr. Burke said yesterday, Tylenol will help. Treat it as, a regular virus, and that's the best way. But if you're concerned, you need to call your physician first. Please don't show up at a doctor's office. Please don't go to our urgent cares or the hospital. they don't have the ability. And right now, we are following the guidelines from the CDC and from the State Department of Health. There are criterias that we have to go through first to make sure that somebody is ready to could be tested.
Do you know how many people have been tested so far in the county?
Exactly numbers, no, I don't. Okay. Because there are some people that live in the county that may be tested. In Pennsylvania, we did get information from some healthcare providers today that, you have a resident of Ripley that might be in Northeast or somewhere along those lines, maybe from Frewsburg, Kyneton area goes to Warren. So we don't know those numbers exactly right now as far as being tested, but we do know that there are tests taking place in the county, and the testing is coming up more and more.
Because what we've heard from officials at the state level is the testing and the reporting of the testing goes back to wherever you reside and your local county health professional. So if you live in Jamestown but you see a doctor in Warren, that's communicated back here.
Certainly. That's one thing that we've been in constant contact with, and really it's been a good communication. If people are being tested outside, or right now if there's negative tests, then we're getting that information back. But correct, if you go across the state line, even if you go across county lines and be tested, then they will make us aware of any sort of response to that.
Now, yesterday, the county launched a new website to try to help local businesses, because with all of these restrictions, which aren't needed to stop the spread, there is that negative impact. And a lot of small mom and pop shops, if they don't have income, they might not make it through a week, a month, however long it is. How are officials trying to relay to the community to say, just because we're asking you to be precautious, asking you to stay home, albeit you can still go outside and enjoy nature, you still can support local businesses though too.
Yeah.
How do we do that?
Well, CHQBuyLocal.com. It's being launched by the CCIDA, the Visitors Bureau, the Chamber of Commerce, and Jamestown Renaissance Corporation. I did hear there were a couple of restaurants that were listed today on the radio that there is, they are giving times and availability for local businesses. But CHQBuyLocal.com is the website. It's, again, multiple groups working together, a unity of effort to get that information out there. It's going to be takeout or delivery only. Some places have limited. You have to find out which businesses are limited to credit cards only, and they will inform you as such. But, that CHQBuyLocal.com, what a great effort for everybody to bind together. And, there's so many, I don't want to say any of my favorites because I don't want to offend somebody if I don't mention their restaurant, but they're out there. And really, friends, take advantage and support, our local businesses. We have one in Mexicali Munchies in Mayville. Mark Calzone's done a great job. He's obviously business has picked up a little bit with the county offices, but we are getting the message out. Support everybody because we're all in this together. And I've talked to Senator Borrello, Assemblyman Goodell, Congressman Reed. We said that today on a conference call this morning at 10. We are in this together. No one is facing any more hardship than others. We want to make sure that we're working together and getting the right message out. And again, when you're out, support those local businesses. As they said, tipping is still encouraged because although they are working, there's a lot of hourly employees, and I've been hearing this from many people contacting me personally. It's like, what do I do? My paycheck hasn't been that big. I rely on my tips, and my heart goes out. It really does because I know this is an impact. We're trying to do the best we can, and as the information for businesses comes out, we are getting that information out to you as well. There has been some Small Business Administration opportunities, and if you go to the CCIDA website, that will be listed as well. Ways for small businesses to get working capital. Also, our local IDA does have business capital loans up to business working capital up to $10,000. If you go to the CCIDA website, they'll be able to guide you through that as well. As we know this is impacting every business, and not only small. Our large businesses themselves are being impacted because, as the nation kind of slows down to a snail's pace, other industries are slowing down, and it's a trickle down effect. Yeah. And my hopes and honestly, my faith has come out more and more this last week. We do. I do pray throughout the day for different things to happen, and our businesses and our residents that we're healthy, both physically first of all, but those that are in business fiscally healthy, because this is going to be a long, long haul.
Certainly, and we've had a lot of people who have reached out because now I know the hours are a little different, where if you did need some sort of public assistance or things like that, how can people get more information about either unemployment and things like that, and then B, are they still encouraged to probably call ahead first before visiting an office?
Mm-hmm. Yeah, I don't want to speak in great detail because I don't know exactly all the details, but if you reach out to the New York State Department of Labor, the criteria for unemployment has changed. You don't have to lose your job to qualify as one of the directives that came out today. So I don't want to touch too deeply on that, but my best recommendation is to look on the CCIDA website, those opportunities. Also, Chautauqua Works. Katie Geis is doing a great job there. They will be able to guide you as far as our unemployment requirements. They have changed tremendously. So again, if you're in concern, please reach out to them. They have the information. They are the people in the know, and make sure we get the right information to our residents. Right. I don't want to guide anybody wrong.
I can speak off the cuff from a conversation I had with a few major healthcare employers who we plan to have on this broadcast next week, because they're looking for workers because they're busy, and they had a shortage before, and now it's only more. So we'll continue to try to follow that aspect of it and continue to update folks who maybe don't have employment right now for whatever reason, and we'll try to get that across to you. I also wanted to talk about the grocery stores here locally. Earlier this week, and I think even into last week really is when it started, people started buying toilet paper and hand sanitizer and things in bulk. Now we have residents who are reaching out saying that they're concerned because they feel like there's just a lack of supplies across the board, and they haven't really seen, like, they'll put out fresh meats and people will come and buy those up. What can we say to that?
I'll tell you, we were on a conference call the other night. There is no gap in the supply chain. There is no problem with the U.S. food supply. It is an ample food supply. It's not even close to being in any jeopardy. And they have urged us. This came from our federal officials, also down at the state level. You know, when people say, well, how can you say that when I go to Wegmans or Tops or a grocery store, there's no meat? Because people are buying everything. You know, you have to be considerate. We don't need, to buy $300 worth of ground beef and steaks and chicken. It will be there. And what's going to help us is by not buying and hoarding food, it's going to show people the food's still on the shelves. Right. Yeah, I went the other night to, just happened to be at Walmart. Frozen foods are gone. I mean, all the bread is gone. The bakeries are open. Those employers, if you listen to what we've all been saying, those employers are still going to be working. Those are essential, and we understand that. The government understands that. So, to repeat, there is no problem with our food supply. It is strong, it is robust, it is healthy, and we just need for people to realize that when you go out, because when you buy in mass quantities, and this is coming from the state, when you buy in mass quantities, the visual is we don't have it. But if you go back the next day, the products are back on the shelves. Right. And really be considerate of our grocers, because some of these are young kids. They're doing the best they can. They are stocking shelves. So imagine if you wipe out an entire section of something, somebody has to go in through the night when we're home sleeping. They're still working because it's essential. And when you come in, it's back on the shelves the next day. So they're doing a great job. Consideration and compassion is going to go a long way in this, because we're in this together. There is, again, I understand people are hurting, and, we want to do as much to mitigate that pain and that stress, but the food supply is healthy. It's vibrant. We are not running out of food. Some people said, they were buying, somebody bought $75 worth of water. There's no compromise to our water supply. This hasn't inundated that water supply. So we are healthy. Our food, our fluids, everything that's out there right now is still in ample supply.
And the stores are doing a very good job of cleaning as well, which we've seen. And with them closing at night, they have a better time to keep that up. So certainly for people who are going to the grocery store, and I know I asked this question yesterday during the press conference, but I just want to ask it again. How can they protect themselves there if they have the fear of, I'm afraid of other people who maybe didn't listen to the warning?
I'll tell you this. Christine Schuyler got a little, I heard a deep breath in a press conference. People are using winter gloves. If you have a pair of gloves, or I've seen, some of our athletes have if your child has the wide receiver gloves, put a glove on and use those gloves. And when you're done, take them off, or if you want to wash them or clean them when you get home. I've seen people do that. They have a winter glove, not medical, surgical, anything like that, not some of our PPE equipment that is vital to our EMS and our healthcare providers, but just a glove that you use around the house. Maybe it's a gardening glove that isn't all dirty. Use that, open the door. If you want to, move through and pick your products up, some like canned goods or things that you feel may have been touched by multiple people, then use those gloves. The other side of it is the grocery stores are urging people it's going to take some time. So they've said it will take more time at the grocery store, but using the self-checkout, using your credit card so you're not touching money. We don't have that exchange from person to person. But, using your own home equipment. If you have a pair of gloves, I know I've got a couple pair of gloves that I use to work around the house. I'll put those in my truck and I use them. And most doors now are the ADA compliant. So use your elbow to push down the door and walk in. Use your elbow when you're pushing through a door instead of your hands. If you're using an elevator, I use my knuckles when I go up and down if I'm not using the stairs in my office building. So there are so many ways. Some people have used Kleenex. They use the end of their cuff. They put their hand in. There's so many ways we can protect ourselves. Be creative. And realize that. What you do is not only helping you, but it's helping somebody else. There's one piece that I want to share with everybody is that, right now our most vulnerable population is the greatest generation, the people that survived World War II and all the atrocities. And some people have just done so much and they've seen so much in that time of their lives. And this is the group we want to protect. They're the ones who have seen the most, who have experienced the most, and at this point have survived the most. We want to make sure that they're healthy and they survive through this and maybe put it up as one more thing that they were able to get through in their lifetime.
And final question I want to ask for you, and I thank you so much for being here today. I think it's really helpful to get this information out to people. In regards to the community's concerns and fears, how should people best go about trying to ease those?
I said it yesterday. Dr. Seuss is a great author, but do what's fun because fun is good. And there is a physical health, but there is that mental health that we all need to keep in mind. Watch a movie, laugh, talk to somebody, tell jokes, read a funny book, play board games. We haven't been told, lock your doors, stay inside, don't do anything. Right. You get out there, do the things that are fun. That's what's going to keep us healthy. Laughter is the best medicine. We've heard that multiple times. So those types of things, and honestly, for all of us in this position, in leadership, we have to do those things. Whatever leadership position you are in, whether it's your business, your community, you need to make sure you're taking care of your personal health, physically and mentally. Get out there and, maybe walk away, turn off CNN, Fox News, the local channels and say, you know what? This is going to go on whether I hear it or whether I hear it now or whether I hear it later tonight. Right. So just, take care of yourselves. That's what I want to urge to everybody. Take care of yourselves, live, love, laugh. We're going to survive this and we're going to get through it.
Certainly we are. And I did say I do have one more question.
That's okay.
I always have, from a viewer who I think this is a good point. They're saying in here, Jamestown seems to be putting everyone at risk by supporting local businesses. I have to work from a local business, which puts me at risk. I think one of the biggest things about the guidelines where the workforce has to stay home, it's trying to get big groups of people, say you're at a conference table session, or even in our newsroom, we've taken steps to try not to be so close to each other. That seems to be what the guidelines are trying to say, where if you go get takeout or you go shopping at a grocery store, you can separate yourself where you don't put others at risk.
Correct. A lot of the grocery stores will tell you they're encouraging or they're trying to enforce is difficult is, the social distancing, 6 feet, an arm's length and more, keeping, staying away from people. The reason for the reduction is limiting, like you said, the group commingling, like we used to do. We're all just a very a society where we embrace one another, and now we're just told not to. So it's really hard for us to understand that. But again, whether we're whatever industry we're in, again, take those precautions, and we want to make sure that you're being healthy. So if it means wearing gloves or those types of things, and again, the one thing I need to urge. If you are sick, stay home. If you are sick, ask your neighbor or ask a family member to go get your groceries, maybe pick something up at a restaurant. The people that are healthy, there is the possibility, that's the concern, but the healthy people are the ones we want doing the transactions to going out and getting food. And hey, you stay away, stay an arm's length away, grab your food, perform those type of measures. But realistically, just use some good common sense in all of this as well.
All right, Chautauqua County Executive P.J. Wendell, we appreciate you being here, and I'm sure we'll hear a lot more from you as we continue through this process. Thank you very much. And just to remind our viewers, we have set up a special webpage on WNYNewsNow.com with more tips and information from public health officials directly from the CDC. You can see it right now at WNYNewsNow.com/coronavirus.
If I could also, if you look at the Chautauqua County Department of Health website, also if you look at Facebook, Chautauqua County Government, and also my own personal County Executive P.J. Wendell, we do get that information up to you. We do have a daily brief at 4 p.m. So that will be the most up-to-date information we have. It will come out at 4 p.m. shortly thereafter in case there's anything that happens. But don't be alarmed if it's 4:15 and it's not out yet.
Right.
Sometimes as we get communication from other people, that it just takes a bit longer to get it right out. But
and
information's there.
And we'll make sure that those links are posted on that page as well, and we'll continue to relay that information. So, PJ, thank you for being here.
Thank you so much.
I appreciate it. Let's check in with Dakota now and a look at our weather. Hey, Dakota.
Hey, Justin, and happy Friday, PJ. Nice to have you in studio. Anyway, let's get into this. We've had a little bit of rain this morning, so these are some of the rainfall totals from across the region. Fredonia at over half an inch, 0.63 inches. Dunkirk more than a half an inch. Jamestown officially at the airport, a little more than a quarter of an inch, 0.26 inches currently of rainfall so far today. Here's a live look at the HD News Now cam. The clouds are bowed downtown. Right now we're at 63 degrees. This is likely going to be our high for today, 63, 64, and then we'll slide back as we get that cold front to move through. Southwest wind of 18. Look at that wind gust of 32 miles per hour. That's going to be the problem through the day today. You can see here the wind gust is 48 in Fredonia, 44 in Dunkirk, 32 in Clymer, and 28 right now in Erie. But those winds will be ramping up as we go through the afternoon as that cold front continues to approach. Live look at radar shows you really nothing across much of the southern tier, but there's another line of showers and thunderstorms back here that's flaring out ahead of that cold front, and you can see here there's already a number of there's already, a few severe thunderstorm warnings down here in Ohio. The main batch of that's likely going to pass us to our south, but as that cold front moves through, there is a chance some of these storms could tap into those strong winds. So SPC maintains that low-end marginal risk, a level 1 out of 5 for the entire area. We're all shaded in green, which means we have a shot for seeing possibly some strong thunderstorms. Let's time it out. The start time for some of the strongest activity will likely be 2 p.m. this afternoon. It'll likely end around 4 or 5 o'clock this afternoon. Strong winds and maybe some flooding is definitely going to be possible, at least aerial flooding, as some of these storms could contain some heavy rainfall. Let's time it out on Future Scan. Warm fronts move through. That's why the temperatures are warmer today. There's the cold front. You can see the showers and thunderstorms flaring out ahead of that front. So again, those could tap into some of those strong winds. That front moves on out to the east, and then any showers taper off tonight, leading to a dry Saturday, although the weekend will be dry but cooler. Zone forecast, inland areas here. This is where we're going to end the day after that cold front moves through, likely mid to upper 40s for most areas, maybe near 50 down in Warren. Spring, we're out though. It's coming back though. Next 7 days coming up, 33 degrees tomorrow. Northerly wind keeps us colder. 45 Sunday. More sunshine though. That'll be good. Monday still needs to be determined. Another storm system could throw us some freezing rain Monday. We still need to fine tune that over the weekend. And then we're back to spring as we head into late next week. Jake?
All right, Dakota, thank you. That is going to do it for us today. Of course, news continues 24/7 at WNYNewsNow.com. And again, we have full information on the novel coronavirus. You can check it out by visiting WNYNewsNow.com/coronavirus. We thank you for watching us as we continue to place facts over fear.